Hey, this is Dr. Mark Sehl from the YouTube channel Therapy for the Heart. That's because it has heart. And it's all about the feelings that govern us and that we can use in our best interests or sometimes not. And one of the ways that we don't use them in our best interests is we attack ourselves. So this is about that. Why do we hold on to self-critical feelings? Why? I mean, there must be a reason. I also talk about this on my podcast on SoundCloud.com and also iTunes, Therapy for the Heart. You can check it out. So why we hold on is because the people who raised us and were important to us, teachers, caregivers, aunts, uncles, parents, they have a big influence on us. So when they say something like, "Oh, that's silly," or don't be that way," we take it into heart because we think that they may be. For instance, a parent might be impatient with us, and so if there's a repeated, "Oh, don't be silly, don't behave that way," uh, don't be so rigid," whatever is said to us, we take it in heart because we can't see that maybe the parent is impatient because they've had a hard day, and we don't see that. It's hard for a child to see that. All they resonates with us, with them, is this feeling of I'm wrong because of the way I behaved. I'm wrong. I'm bad. My needs are bad because they were criticized. I was criticized because of the needs that I have. So why we hold on to these self-attacks? Because to let them go, we would feel deserted. These were people that were important to us, teachers, as I said, parents, aunts, uncles. They were important. We loved them, and we became like them, just like them. So to disengage from that attachment means a loss, means a terrifying loss at times, even though the attachment is filled with negativity at times. It's a big void that we would have if we let go of those attachments. So that's why we hold on to them, because they are people who have been very important to us. And it's like you keep your friends close and your enemies even closer. So, and that goes for this also. Supposing a caregiver, repeatedly says to the child, in terms of their own frustration about the things that they have to deal with in life, the finances, fights with their spouse, they get overly irritated at the child and say, "Go to your room," or "Don't say that," or "Why don't you behave properly?" So all these things are taken in as something that's the last word. It's the child can't see beyond what they're feeling about themselves, and what they're feeling about themselves is bad, and their needs were wrong. Therefore, they're bad because their needs were wrong. So there's many reasons why we hang on to these negative self-feelings. And also, they've been there for a long time, so people might come in to see me for therapy, and they might say, "Well, how long is treatment going to be?" So I said, "Well, how long? What's your expectations about treatment?" They might say 2 or 3 months or 6 months, and so if I ask them how long they've had this problem of feeling very negative towards themselves and self-critical, they might say, "Well, I've had it all my life." So they expect a very quick fix, and that's just because they're human beings. They want to get the pain over with, but it's not realistic. Sometimes I'll ask them if how long have they had the problem of negative feelings about themselves, and they'll say, "All my life." And I said, "Well, do you think it's possible to correct something in 6 months or 3 months if you've had it all your life?" And I'm using reason. Of course, they're using emotions. They want to be out of the pain, but it does take a long time, because many people have these feelings and they've had them all their life. So So how do we work with them? Well, first of all, if you're with a therapist who is hopefully compassionate and understanding, what you want in therapy is you want to feel understood. The most important thing, to feel understood. So if that's there, it's a big start. And also if the therapist is compassionate and sensitive, and it doesn't force you into any kind of fixed mold about what they want as far as therapy. You know, you really want to be encouraged to discover yourself, not to be encouraged to fit into a formula of their theoretical frame. So if you meet somebody that someone's like that, and then also if their compassion is great, understanding is great, and also are they able to hear your criticisms of them? And this is a very essential point in this talk, because how do you cure these critical self-feelings? Now, a therapist whose compassion is internalizing some way along the way as you go and meet with the person and feel like they aren't understanding you, they're not going to judge you, they're not going to throw you out of the office because of something you said. So you build up that relationship, and that relationship is internalized as you have this relationship with this person who, for the first time in your life, maybe you said something and they didn't judge you. So that's very positive. That helps. But another thing is that doesn't remove these self-critical feelings. And how we work with those, at least how I work with them, is to help the person take those negative self-feelings from the ego and put them in the object world. That's a very complicated. I mean, how are you going to understand that? But in the ego, it means that that's where these feelings reside. There's the id, ego, and superego. So the id is, wanting pleasure. The superego guides us in terms of behavior that's appropriate, that fits with the world's expectations. As long as it's a benign superego, a critical superego is not too good to have. So that's the ego. So we want to help move these interjects. And it's not like you're going to crane and then you're going to lift them out of the ego. The ego, it doesn't have a physical place, but I think you get the idea that the ego's where our defenses reside, how we defend ourselves and protect us. The ego helps us see things rationally and mitigates between the superego and the id. So in order to do that, to move them from one place to the other, we help patients criticize ourselves over time. We help them say the very things that they could never say when they were young, because if they did, they would be reprimanded, scolded, abused physically and or emotionally. So we help them say the things that they could never have said. And that's why I start slowly. Sometimes I will ask, it's not sometimes, I usually build that into my therapy, is to ask them how the therapy is going. And I check in with them because I want to hear what they have to say about the therapy. And so if there's somebody is too polite, and it's hard for that person to say things that are critical, I might encourage them one way or the other. I might say, well, you're the only person who has no criticisms of me, or most people have criticisms of me. So I'll start with that. And an example that comes to my mind, because it was very pointed to the point of this talk, is I was in the office and I was trying to help this person express his feelings about the way I work. So he's very reticent, he's very resident. He says, well, as a matter of fact, I don't like that tin ceiling that you have up there. I says, oh, really? What don't you like about it? It's old-fashioned. Now, this is what I worked down on 9th Street. So they did have tin ceilings at those apartments at the time when they were built. So this is old brownstone. And maybe if some of you probably had maybe not remember that, but anyway, he said that he didn't like the tin seals. And he said, as a matter of fact, I said, is there anything else? And he said, well, as a matter of fact, that piece of furniture that you have over there, you probably could have left it in the basement. That's great. Good for you. So it's people like that are not going to, he was unusual. I mean, I worked with him for a long time, and he was able to say these things because I always built it into the therapy to want to hear these kinds of criticisms. And so that's how you do it. It gets into the object world being me. So in a safe environment, which takes a long time to establish in therapy, the person can say everything, loving, hating feelings, talk about anything that they've never been able to talk about, like things that they weren't supposed to even think about as a child because maybe they were brought up as a Catholic, or other religion. You weren't even supposed to say these things out loud because they were sins. And now they get a chance to say them, and you're not going to get thrown out of the office. And that's a breath of fresh air, I think, anyway. Like when people blush, I love that because they're revealing something that's not so perfect about themselves. Maybe they forgot somebody's name, or when they get angry with me, and I think that's wonderful. Or cry for the first time. Many people have not cried very much, even though they've been tormented or forgotten about or treated indifferently. They have not been able to cry. So it's wonderful to see people cry. Cry has a function of relieving the psyche of the burden that's been carrying around for a long time, perhaps. First time they can cry or get angry or laugh. Sometimes some people are very rigid and they don't think that they can let loose. So sometimes when people let loose here and just can laugh and loosen up. And maybe the people who are also laughing all the time, they can have a chance to look at the serious side of themselves also. So we have all different sides of us that are important to look at and to understand with compassion and not criticism. So I hope this video has been helpful to you, why we have an attachment to negative self-feelings, and it's for our protection because we don't want to disengage for those who have been responsible for these negative feelings. And in the worst case scenario, if we don't have much at all positive, at least we have the negative, because indifference or having nothing at all is the worst thing. So I hope this has been helpful, and if you have any questions, you can comment on the video, make a comment, and that would be great. Or also can download some of the other videos. I also have the podcast, as I mentioned, Therapy for the Heart. Enter that in SoundCloud.com or iTunes. So until the next time, I bid you adieu, and I hope you have a great Thanksgiving, if that's what you celebrate, and a healthy week. Okay, so this is Dr. Mark Sehl for the YouTube channel Therapy for the Heart. I'll look forward to you being here so I can speak with you about things. And if you have any questions, email me at marksehl@gmail.com. So thanks a lot for listening.